Okay, welcome everyone. Thank you for joining us today. I am Dr. Jeannie Hannon, the Director of Programs for A Time to Heal Cancer Foundation, and we're excited that you're here joining us for today for Alcohol's Cancer Connection: How to Raise Your Glass Without Risk. And I'm excited to introduce our speakers today and our mocktail bartenders. So I will start first with Leanna Topko is a policy and research coordinator for Project Extra Mile. Leanna joined Project Extra Mile in December 2017 after completing her master's in public health. She has worked as a research associate where she has had the opportunity to refine her research skills, gain insight of public health, as well as work on manuscripts and policy briefs. She is very passionate about making a difference in the community. And then I'm also going to introduce to you Brenda Helget, the Executive Director for A Time
Thank
to
you,
Heal
Jeannie.
Foundation.
Hey, I just want to say hi to everybody and thank you so much for signing up for this. I met Leanna at a meeting and I was talking to her and I thought this sounded like an excellent topic to present to our cancer survivors because I did not know that cancer is carcinogen. That was surprising news to me, and I assumed it might be of a surprise to other folks. So we want to get into the whys and the hows and all those different things. So thank you so much. And in a little bit, uh, I am going to be your mocktail bartender along with my dear friend Brandy Hollis, and she is a bartender extraordinaire. Um, and I've drank a lot of mocktails, so there's my experience. So there you go. So thank you so much, and Jeannie, back to you.
Okay, thank you. Thank you, Brenda. Okay, we are so excited for this event today. And yes, please stay around for the mocktail demonstrations, and we will have some prizes at the end too. Okay, Leanna, if you are ready, I will turn it over to you.
Thank you so much, Jeannie and Brenda, for the invitation to be a part of this. It was lovely to meet you a couple months ago and now work together on raising awareness of this issue that I also wasn't aware of until I joined the organization 8 years ago. Like Jeannie said, I'm Leanna with Project Extra Mile. I received my master's here in Omaha at the University of Nebraska Medical Center, my master's of public health, and then jumped right into my role of policy and research coordinator. So today, let me see if I can get this to cooperate. There we go. We'll explain the link between alcohol use and cancer risk, describe the impact alcohol has on the body as it relates to cancer, and also identify current policies and public health efforts aimed at reducing alcohol-related harms. So the organization I am with is a nonprofit organization called Project Extra Mile. We are located in, I would say, sunny Omaha, Nebraska, but it is currently snowing and it's about 15 or so degrees. So I definitely have a hot mug of coffee to keep myself warm. Hopefully everybody's staying warm and safe during this winter. But our organization, our mission is to advocate for evidence-based policies and practices to prevent and reduce alcohol-related harms. We were established 30 years ago in 1995 with five focus areas. They are policy initiatives, enforcement collaborations, media advocacy, education awareness, and youth leadership. We also have a statewide coalition where we try to help other organizations, they try to help us. We collaborate however we can to reduce alcohol-related harms. And then one of our bigger focuses in this upcoming year, is raising the awareness of the link of alcohol and cancer. So overall, we do take an environmental approach, which means I'm not just looking at or trying to impact the decisions one individual is making, but what is impacting the decisions they are making as well. So two-pronged approach. So what is a standard drink? That actually depends on the type of alcohol you are potentially consuming. So for a beer that's about 5% alcohol, it is 12 fluid ounces. Whereas if someone is consuming something stronger, such as vodka or tequila, it's only an ounce and a half for a standard drink. And I will also highlight that the craft beer industry is quite robust in Nebraska throughout our nation. And a lot of those beverages are actually a bit stronger, 7, 8, 9% alcohol. So that standard drink size decreases to about 8 to 9 fluid ounces. What is excessive alcohol consumption? There are 4 different categories of this. Binge drinking, which is 5 or more drinks per occasion for males or 4 or more for females. Heavy drinking, which is 15 or more drinks per week for males, 8 or more for females. Consumption of alcohol by those under the legal drinking age of 21, and then any alcohol consumption by individuals who are pregnant. So nationally, about 15.5% of adults report binge drinking, or here in Nebraska, since that's where I'm located, it's 19.7%. For heavy drinking, it's 6.2% of adults nationally, 6.5 in Nebraska. And underage, it's 22.7% of our youth throughout the nation and 18.9% in Nebraska. There is no percentage like this for drinking by pregnant women, but a research study was done several years ago that actually just looked at economic costs associated with it. And unfortunately, Nebraska had the highest rate of cost associated of excessive alcohol consumption by pregnant women. So, did you actually know that excessive alcohol consumption is the 4th leading cause of preventable death in the US? We lose more than 178,000 individuals per year to this, and it's almost 4.3 million years of potential life lost each year. So, this research was conducted by the CDC, so this is 2020 to 2021 data, but every year it's about 178,000. And then it was also estimated that about 7.1% of emergency department visits involved alcohol. So what are the harms? There are short-term and long-term issues with excessive consumption. For short-term injuries, violence, alcohol poisoning, reproductive risks. And I would also move injuries into potentially long-term impacts, just because if you think of a car crash, somebody may just have a broken arm, or others may have a more disabling injury from that. And then for the long-term harms, we have chronic diseases, at least 7 different types of cancer, which we'll definitely be diving into here in just a moment, learning and memory problems, mental health conditions, social problems, and then alcohol dependence. So how alcohol increases cancer risk? DNA damage. So our DNA is the blueprint, the architecture of our body. And if any of that gets damaged, then we are at greater risk of injuries, of issues such as cancers, because alcohol is metabolized into a toxic compound, which then damages our DNA, or it can damage it, therefore preventing the body from repairing this damage, which could lead to mutations, which then again could lead to different cancers. Nutrient absorption, this alcohol consumption impacts our body's ability to absorb nutrients such as folate and various vitamins, which are needed to build up and keep up with our immunity and DNA repair. Hormone levels, so increased in consumption of alcohol causes hormonal changes, which by increasing levels of estradiol, which spurs cell growth, therefore specifically raising the risk of breast cancer. Liver damage, so chronic alcohol use can lead to liver cirrhosis, therefore increasing the risk of liver cancer. Inflammation, alcohol intake causes inflammation and impacts our immune system, which then again impacts cell growth, DNA repair. And then also increased absorption of other carcinogens. So alcohol acts as a solvent, therefore, when it is in our mouths, it can expose our bodies to other cancer-causing chemicals, such as tobacco smoke, to then be absorbed into our bodies, and therefore significantly increasing our risk of head and neck cancers. And again, it all goes back to our DNA, our blueprint, our architecture, which is keeping us healthy and whole. And for this next slide, I will turn it over to Brenda to discuss a little bit of how DNA repair helps prevent cancer.
Thank you, Leanna. So folks, just a little bit more about me. Obviously, I've been with a Time to Heal Cancer Foundation now for almost 5 years, but I'm also a cancer survivor. And I got my start a nonprofit working for the Nebraska Council to Prevent Alcohol and Drug Abuse. So I do have a background in this, but I really wanted to talk to you about, the DNA factor, because that was really shocking to me. Because one of the questions I asked, right off the bat was, okay, so alcohol is a carcinogen. What does that mean? Does that mean, we talk about there's different levels of alcohol, shall we say, or different volumes in beer versus wine versus cocktails, right? And different kinds of things. So what we found out is just what Leanna shared is that it's the alcohol itself. Okay, it's the alcohol itself. It's not the fermentation process. It's not this. It's not that. It's the other. It's the alcohol itself that is harming your DNA. So what does that mean? How many of you, show me, how many of you are old enough to remember when you had to defrag your computer? Do you guys remember that? Raise your hand. Oh my gosh, how fun. And why did we have to defrag our computers? So you can see the picture on here. For those of you that are young and don't know what that means, your computer is working all the time, right? Processing information and then deleting and building new information. So if you look at that picture, think of this as your DNA at work, right? So it's constantly moving and moving around and repairing. It sees cells that are damaged and it repairs them, quickly repairs them, puts them in line, and then everything runs smoother in the body. And also, it is making it so it can stop mutations because those mutations of cells is what can turn into cancer. Okay. So, why is that also important? You think about well, here's a great example of defective repair in cancer, the BRCA gene, right? So we know those defects increase our risk for breast, ovarian, and pancreatic cancers because it's failing to repair breaks in the DNA. So that is why alcohol is in itself a carcinogen, and that's why it's so important for us to think about what can we do as cancer survivors to help prevent reoccurrence, right? And also, I want you all to think about and remember that we can only do the best that we can do. It is important to note, Leanna will tell us as we continue, there is really no safe amount of alcohol, and that is the rule of thumb. But what I can tell you today is our goal is to educate you and inform you, and we want you to go forward and do the best that you possibly can. Any subtraction, any reduction in your alcohol consumption is going to be helpful, right? It's just like exercise. We don't expect you to be out running a marathon tomorrow. So we want you to walk away with this kind of information. And also in a little bit, we're going to have some fun and we're going to make some mocktails. So you won't even alcohol. We don't know her. We don't need her. Leah, go ahead and continue.
Thank you so much, Brenda. Yeah, this is definitely an opportunity to just consider our own consumption if we do consume, and also share the information with your friends, your colleagues, those around you, because it is only about 40 or so percent of the population that are aware of this link. So the more we get this information out there, the hopefully healthier decisions everybody can be making for themselves. So alcohol attributable deaths in the US, I mentioned earlier that we lose about 178,000 individuals per year to alcohol attributable deaths. And this is about 5% of the total deaths. I just looked that up before beginning this presentation today in the US per year. And of those, we have about 17,000 that are alcohol attributable cancers. And again, all of these, because they are alcohol attributable, they're preventable. So these 178,307 individuals that die, these deaths are preventable by the decisions we make, by the decisions our community members make, and also by the policies that are out there. And then chronic diseases, especially cancers, heart disease, so forth, that's something that the alcohol industry is kind of concerned about because obviously they know it'll impact their bottom line. So they're trying to influence perceptions of oh, alcohol could be healthy, it can be fun, and so forth. And we'll dive into a bit of that here in just a moment. So those cancer deaths are about not 900, excuse me, 9.6% of those total alcohol attributable deaths. So as I was putting this PowerPoint together, I knew some of this information that I'll share in just a second, but it was interesting to see just how far back this research goes. So in the 1930s to the 50s, epidemiologists actually began linking heavy alcohol use with different cancers, especially those of the mouth. In the 60s and 70s, there were more improved epidemiological methods confirming some of these associations. And in the 80s, there were large cohort and case control studies that solidified this link. Therefore, in 1988, bringing the excuse me, IARC, or International Agency for Research on Cancer, to officially classify alcoholic beverages as a group 1 carcinogen. 90s to 2000s, there was more research expanding beyond just the mouth and throat into colorectal and female breast. In the 2010s, there was more analyses done, which showed that even light to moderate drinking increases cancer risk. And then the 2020s, the WHO, CDC, and the American Cancer Society explicitly stated that no level of alcohol consumption is safe for cancer prevention. And again, I'll also highlight that yes, it's no amount of alcohol, but it doesn't matter what kind of alcohol, whether it's beer, wine, spirits, they're all unfortunately have the potential to cause cancer in our bodies. So that carcinogen classification, what is a group 1 carcinogen? It basically means that there is a positive or causal association observed in the evidence on exposure to the agent and cancer in the studies in which chance, bias, and confounding were ruled out as with reasonable confidence. So other items that or other examples of a class 1 carcinogen, which is what alcohol has been labeled as, include that one I can never say, but it's the acetaldehyde. I'm sorry. That one is a very bad one for me to say. And it's also items such as asbestos, and you see tobacco, smoke, sunlight. All of these are in the same category of risk and carcinogenity to us in our bodies. So what are the 7 types of cancer? You have the mouth and throat or oral cavity, the pharynx, the voice box or larynx, esophagus, liver, colon, and rectum. So it kind of makes sense where the alcohol flows in our bodies. For females, also the breast. And then there is also emerging evidence on the pancreas, stomach, and prostate, but this has not been officially confirmed yet, but they are leaning more towards that direction. So how do these different cancers break down nationally? So of those 17,072 in the US that die from alcohol attributable cancers, this is how it breaks down, liver being the most prevalent, and then a close tie for second place, so to speak, is the oral cavity, the colorectum, as well as the breast for females. So specifically in Nebraska, there are about 1,001 alcohol attributable deaths every year. Majority of them being from chronic diseases, including 112 cancers, which is 11.2%. And then it's more than 22,000 years of potential life lost. The Department of Health and Human Services here in the state shared with us that in 2021, there were over 9,000 alcohol-related hospitalizations. And then in 2019, Nebraska had 10,545 new cancer cases and 3,470 deaths, which some of this information, especially those who are working in the field of cancer, it's probably not new to you, but just wanted to make sure that I share that with you. And again, these are preventable deaths due to the involvement of alcohol. And this is how it breaks down in Nebraska. Of the 112, majority, again, are the liver, with colorectum being second. If those of you who are very quick at math in your head, you'll see that the numbers on the screen do not add up to 112, but that's because Nebraska is a much smaller sample size than the entire nation. So due to privacy and health restrictions, if it's just 1 or 2 cases, that is not able to be reported. So actually, give me just one moment to take a sip of my coffee here, or tea. So in January of this year, 2025, the Surgeon General put out a new advisory on alcohol and cancer risk. This outlined the direct link between alcohol consumption and increased cancer risk. He called on Congress to update the existing Surgeon General's health warning labels on alcohol-containing beverages to make the warning labels more visible, more prominent, and therefore more effective. And he also recommended changing the dietary guidelines to account for the alcohol cancer link. So right now, you definitely know much more about what is in your slice of bread, in your cup of milk, tea, whatever it is, than what is in alcohol. So we'll dive into that in just a little bit here. But I will also share that our organization invited a representative of the National Cancer Institute to speak with us. He was unable to make it at the time because of the government shutdown. But he did share that there is going to be a new report coming out, I believe, this spring on alcohol and cancer. So hopefully be on the lookout for that. Definitely interested to see what will be in this report, maybe what recommendations they have or more specific information as well. So alcohol labeling efforts, those have been going on for a while. There have been national efforts to improve current labels on alcohol since 2003. And in 2002, actually, consumer groups sued the Alcohol and Tobacco Tax and Trade Bureau because they are the ones in charge of those labels to and ask them to like make these much more effective than what they are. This resulted in the TTB proposing to require food allergen, ingredient, and alcohol facts labeling of all alcoholic products. This has not yet been finalized. We're waiting for the final recommendations and requirements. So as you see on the slide, it does not mention cancer, but I will share with you just 1 second why I am sharing this information. So alcohol facts, they want to make sure that we know what the alcohol content is, nutritional content, so just calories, carbs, fats, and proteins. And also, what is the appropriate serving size for the beverage? And also, food allergens. Many individuals suffer from different allergies from milk, fish, eggs, and so much more. I want to make sure that if somebody is choosing to consume alcoholic beverage, that they are safe, that they're not going to have a shock or a reaction to it. But in earlier this year, there was an opportunity for individuals, organizations, coalitions to actually submit comments on these labels for the TTB to consider as they're moving forward. And or our organization, and I'm sure others across the nation as well, also shared like, yes, you definitely need these labels. But could you also include the fact that it's a carcinogen, that consuming alcohol puts individuals at risk of cancer? We don't know if any of that will move forward. We're definitely hopeful. I know there have been efforts in other countries, such as Canada, and I believe it is Ireland as well, to put more information on these products to ensure that consumers are in the know of what they're consuming. So the U.S. dietary guidelines, these are 5-year guidelines that are or guidelines that are updated every 5 years. I'm sorry. So for alcohol, it states that individuals who do not drink alcohol should not start drinking for any reason. If adults ages 21 and over consume alcohol, it should be limited to two or fewer drinks in a day for men, and one or fewer drinks, or half a drink, I guess, for women. And the reason I share this is because there was actually a new study that came out just last year that approximately 16,800 deaths could have been prevented if adults who drank alcohol in excess of the guidelines reduced their consumption to what those guidelines are. And then an additional 650 deaths could have been prevented if men consumed 1 drink per day rather than the 2 drinks that is currently in the guidelines. Excuse me. And there have been various attempts throughout the years to actually change the guidelines for better or for worse, but no changes have been adopted. These have been the guidelines for at least 3 or 4 iterations, I believe, of the guidelines. So currently, the work is being done on the 2025 to 2030 guidelines. And there have been some rumors that the numeric guidelines for alcohol may actually be removed. It is uncertain. I believe those are supposed to come out in the next couple months, the early 2026. So then in 2018, the American Society on Clinical Oncology put out a statement on the alcohol and cancer link and discussed recommendations. Excuse me, sorry about that. Recommendations for how to reduce cancer risk. Because as we discussed, there are at least 7 different types of cancer. So these are some of the guidelines that or recommendations that they put out that have also been recognized by many other organizations, such as the WHO or, oh goodness, Preventative Services Task, Community Preventative Services Task Force, and others who look at alcohol, cancer, or in general excessive alcohol consumption. So increasing the price of alcohol through taxation and making products more expensive, therefore those who consume in excess would drink less. Regulating outlet density, basically how many establishments are in a geographic area. Maintaining limits on days and hours of sale. Restricting youth exposure to advertising. And with that, excuse me, eliminating pink washing in marketing of alcoholic products. What is pink washing? Um, um, all of you are, I'm sure, aware that October is Breast Cancer Awareness Month. It's a great time to highlight the harms and how we can help survivors, and also those going through it right now, of how to help them get through it. But pink washing, unfortunately, the alcohol industry will put pink ribbons on alcoholic products when actually that product is potentially harming the women who have breast cancer. Um, so eliminating that would be great and finding other healthier ways to promote awareness of different cancers. Screening adults for excessive alcohol use and, of course, cancers, looking at what are your daily, what are you consuming daily? How are you treating yourself? How can you improve your health? Enhancing enforcement of of different laws, and then also further resisting privatization of retail alcohol sales. And again, as I've been mentioning throughout this presentation, alcohol is a choice that we choose to drink or not to drink. And even if we're drinking and we decrease by a little bit, that will decrease our risk of being exposed to cancer or potentially being exposed to cancer. So in general, focusing on affordability, availability, and advertising will impact the environment. Then, of course, for individuals, screening early on to make sure that you're making healthy decisions and you know what risks you're potentially putting yourself at. So I will open it up here for questions. So like I said, I am located in Nebraska. I'm sure there are individuals on this call from across this nation. So there are organizations throughout the country like ours, bigger, smaller, that would be happy to, I'm sure, work with you, or maybe I can help make a connection. Or if you just want some more information, please feel free to reach out to me. My email address is here. Our website has different fact sheets on it and so forth where you can learn more. Follow us on socials. We're trying to raise awareness this year and in the coming year of the alcohol and cancer link by posting on social media. So if you follow us and like those posts and share them with others, we're going to be doing a service to all our community members by spreading this information and how individuals can hopefully make healthier decisions for themselves. So I will open up for questions right now.
Thank you so much, Leanna. That's great. There was a question in the chat box. Do beverages that have beverages that have THC, CBD figure into this like alcohol, or are these products too new? Do you happen to know, Leanna?
That is a great question. I do not know. And I think just as the question stated, is probably because it is such a newer product. But a guess would be yes, there probably is a correlation. But again, that is just a guess. That's not based on any science that I'm aware of yet.
Can I take myself off mute? Is that okay?
Absolutely.
Okay, thanks. So I have heard recently, just comes across my Facebook feed or whatever, stinking algorithms. are you seeing that alcohol consumption is actually decreasing? Just based off of my own uh, observations, I don't see it, but they keep saying that historically they are consuming less. They meaning the general public.
Mhm.
So I think generally you are correct. There do seem to be reports going out there based on like the different binge drinking data and such. It's kind of steady-ish. But then also there's that difference that actually women now are consuming at higher rates than men. So that gap that used to be like this wide is now kind of narrowing. So unfortunately, we women are placing ourselves at greater risk for cancer as well with that.
So, Leanne, I'm going to chime in here because this
Yeah.
is something I'm going to talk about as well. You also have to remember, SAMHSA and other groups, they're really focused on binge drinking
Mhm.
and excess, right? So, I'm not sure that they're kind of been focused on those people that are averaging maybe one drink a week or, or going out with the girls or whatever. Here's what I can tell you that is going to lead us into the next section. I remember 20, 30 years ago, you couldn't find a non-alcoholic anything to save your life,
Mhm.
right? You couldn't. And if you did, it was nasty. Tasted horrible. Let's be honest, okay? I am astounded by the number of bars, by the number of restaurants. It's becoming very trendy to have mocktails. So what I can tell you about that, even though I'm not a researcher or et cetera, guess what? They wouldn't be doing that if they weren't selling. If there wasn't a demand, they wouldn't be doing it. I went to the liquor store just yesterday and I was astounded. There was an entire shelf of non-alcoholic spirits, wine, sparkling wine. Uh, it's incredible. It really is incredible and so heartening to see. And more mocktail mixes and all the things. But just go to a restaurant and a bar again, you'll see, oh, you can get it as a mocktail, and that's great. 10 years ago, you didn't see that. This has been very recent, and I do think people are just becoming more and more aware of their own physical health and wanting to do better and be better. So that is very heartening. But Leanna's message is so important, so important for us as cancer survivors. Again, we're trying to do whatever we can. We don't want our cancer to come back, right? We just
Right.
don't. And but I am excited that it just seems like the universe is making it easier for us to not partake, and that's what's really exciting.
Yes. We've got some chatter going on here in the chat box. So awesome. So Brenda, along with what you said, Maquita mentioned that she had seen an article that stated that restaurants were losing revenue because people are buying less alcohol. But then we also had a question. What about your past consumption? Is there anything that you can do about that?
Um, I mean, if you stop or reduce consuming, that will decrease your risk no matter what. Your past consumption is there. I mean, I personally will drink a glass of wine here and there as well. I'm aware of the risks that I am potentially putting myself at. But again, if you are consuming right now, if you reduce or quit, that'll definitely help you. If something has already maybe started forming in your body that's harder to say. Unfortunately, I don't know the full science behind it off the top of my head. Um, but yeah, any reduction of consumption will help reduce risk. And I'm trying to pull up the current data for alcohol consumption that Julie was discussing. And unfortunately, my CDC website keeps hanging up on me.
And if I could chime in, so Jeannie and I went to a conference in Des Moines recently, and we had a mocktails, and guess what? They did not discount that one little bit from a regular cocktail. So, I don't know what some of these bar owners are talking about, but the smart ones are saying we're going to charge the same, especially because, well, you'll see here in a minute, there's labor involved, in making any drink. So they're probably thinking, well, why should we discount it just because the alcohol is not there? It still takes us just as long to make it, et cetera. So we'll get into that here in a minute.
Mhm. Yes, and I think the last question kind of answered this question as well about this stopping drinking reduced cancer risk significantly, even though there was a fairly long period of alcohol consumption. So I think it kind of,
I believe it
yes.
does reduce. And then there was a study, I don't have it right in front of me, that was released recently where it looked like not consuming less, but like if you're drinking one drink, it's this much risk. But then if you have two drinks, it significantly increases that risk as well.
Mhm. And we do know with tobacco as well, if you stop smoking, for a long period of time, that definitely helps. Let's hope it's the same way
Yeah.
with alcohol. And maybe it all goes back to that the DNA and an ability to repair itself. The longer amount of time it has to do so, maybe, again, it's defragging. And the
I was just
longer,
thinking that.
yeah, the longer you have to let it go ahead and defrag without constantly making it worse,
Mhm.
I would think that would be helpful. Again, I'm not a researcher or an oncologist, but I want to believe that that's probably how it goes. I think most doctors would tell you that, the longer you can, stop and let the body heal, the better off you're going to be.
Definitely.
Great. Any other questions before we get into the mocktail making?
And if anything comes up afterwards, do feel free to reach out to us. Like I said, follow us on socials. Happy to connect with you, whether you're in Nebraska or not. We're always looking for new partners, new connections.
Leanna, thank you so much for sharing your expertise and your time with us. All right, Brendan, Brandy, are you ready?
We are so ready. And I was amiss. I should have introduced Brandy properly. She actually has a master's in public health. So she is
Health education.
health education, excuse me. So she's very well qualified to be here today.
Not for the drinks.
Yeah, let's be honest. But anyway, I just wanted to make sure I introduced her correctly. So Brandy and I are good friends. She's like my little sister, and she luckily lives only a couple doors up from me because I don't know, you guys put in the chat. If you're not in Nebraska, what's the temperature where you're at? Tell me where you're at.
Please
Let
somebody
me
tell me it's like 80.
I think there was somebody who signed up from Alaska, so we don't want to know that one. But tell us what's going on in your neck of the woods. We'd love
Well,
love
looks
to
like
see
somebody
it.
has sunshine. Somebody
I
turned their
know.
camera on.
That's
It's like some
wonderful.
sunshine.
Well, look at Jeannie's background. Oh, we all wish. We all wish. Okay. So we are here to have some fun, right?
Yes.
And so a couple of things I want to talk about. Again, we were just kind of talking about how it's much easier now if you want to do mocktails to find substitutes for alcohol. So one of the things that you may not be aware of is zero proof spirits. Okay, so these are actual dupes for things like vodka or gin, etc. This one is actually an elixir that is made locally here in Nebraska, and this one is actually cranberry. It's like cranberry vodka. They are not cheap. So I think this one was $26 or something like that. I did see some, it is a fairly big bottle though. It's 25 ounces, so it's a lot. And it would make a lot of drinks. But when I was at Hy-Vee, a local grocery store in the Midwest, I saw those bottles were around $40. So they're not cheap. However, we have some dupes for this kind of spirit. If you want to do something like that, you sure can, but you don't always need to. So one of the things that we've kind of found that people miss maybe in the taste is, alcohol doesn't really have a flavor, right? But it has a kind of a heat to it, a bite, if you will, a tanginess. how would you describe it maybe? Or a tartness maybe?
Tartness
almost?
or sometimes kind of a spice
A spice.
can be what the taste is.
So some really good dupes for that taste that you can add to your mocktails is ginger ale would be one, or ginger beer is another one. So we see that in a lot of mocktail recipes. So we're going to talk about some recipes we found, and I'm going to call out a wonderful uh, uh, website called mindfulmocktail.com. And it's free for anyone to use, mindfulmocktail.com. And it's very easy breezy. And we found some wonderful recipes we're going to share with you today. And we will send these out to everybody afterwards too in an email, okay? So we have a cranberry orange spritzer, and we're going to talk about that. So this is our cranberry orange spritzer. And I'm going to put my hand in here, but we dressed it up with a little bit of cranberries, just use a simple toothpick and like a shish kebab, right? And a piece of lime. And that really helps dress it up. But also notice the glass. So I'm going to tell you something funny before I tell you what the recipe is for this. And maybe not funny, but something to think about. Oh, the snow's coming down. It really looks pretty. Uh, most of us here are cancer survivors, right? And one of the things we learn at A Time to Heal through our Survivorship 101 programs is we talk about trying to find our joy again and finding the things that make us happy, the small things in life, right? Like sunshine. Don't have any today, but we have mocktails. Something that makes me happy. And when I think about a mocktail, I think about 80% of a mocktail is the presentation, right? So I love to buy fancy glassware just to make me happy. Okay. And that's something any of us can do. If you've got a Home Goods or a TJ Maxx in your town, guess what? Look at all the beautiful kinds of glassware that you can get. And again, isn't this fun? Look at that. That you can get to just dress up whatever it is you're drinking. I don't care if you're just having orange juice, right? The website is mindfulmocktail.com.
That glass matches my sweater beautifully.
It did. And then, so I encourage you, make it festive. Start with a beautiful glass. Okay. So for this cranberry orange spritzer, we have half a cup, which is 4 ounces of cranberry juice, a quarter cup, 2 ounces of orange juice, and a quarter cup of ginger ale or Sprite, 7-Up, or your favorite sparkling water. That's all it is. And you can garnish it with the fresh cranberries or a sprig of rosemary or mint. And that really dresses it up. And so you just fill the glass with ice, you just pour in the juices and then stir it and then top it off with your ginger ale or your sparkling soda and you're done. It's that easy. And what I would say to you, like I think when we first made this, we felt like it needed a little bit more ginger ale or something, a little more bite to it to make us feel like, okay, that tastes more like a spritzer to me. So it does take some experimentation to find the best way to do it for
And
you.
sometimes just squeeze a little bit more fresh lime in it too. It's all about our taste.
It is. So do you want to talk about the Mary
Let's speak
Mojito?
about the Mary Mojito here.
Yes.
So that was what I was taking a sip of. This is really, really good. A key to a mojito is actually muddling. So I have mint leaves in here.
Okay.
And when you muddle, you really do want to put your muscle in it and beat up, excuse the wording, beat up your mint a little bit so that it really brings out the oils.
Can I show them what you're doing? So she's just smashing the leaves basically with this. This is pretty heavy. And she's just smashing it down. And you don't have to have something like this. I just happen to have this because I'm fancy like that. But you certainly don't need to be. You can use a wooden kind of a dowel thing or whatever you can
You can use a
find.
spoon
You
even.
can spoon.
I have a
Hands.
I have a wooden, yes, some people say clap your mint. I'm not a fan of that personally, but there's bartenders that go by that for sure. I have a wooden one and it works just fine. You don't have to put as much muscle into this one. I will say that. And then you just put that in your glass. You here. And it smells so good.
So it says about 6 to 8 mint leaves is what it says in the recipe, if you're not sure. To me, I almost can't have too much mint. I love mint. So-
Brenda, sorry to bother you here, but
No,
what were you
not at all.
smashing? What were you smashing? I missed that.
Mint leaves, mint
Huh?
leaves. Leaves
Oh.
of mint. Mint.
Oh, okay.
Yeah, so
Thank you.
sorry.
Thank you.
Thank you for saying something. So leaves of mint.
Yes. Yes.
Okay.
So then this is simple syrup. You don't have to buy simple syrup. It's really easy to make. I usually boil hot water, equal parts hot water and sugar on the stove. Some people say that is way too much work and you can do it in the microwave.
You know what I do? I do powdered sugar and just mix it, I think, with water or something.
Yeah.
Yeah. I mean, it's super easy to make a simple syrup. You can buy simple syrup as well at the store if you
Yes,
want to.
we're kind of taking a shortcut for today. And then this is probably 1/4 of a lime, and you really want to squeeze all the juice you can out of it. And I think that's kind of what makes this is the really fragrant mint and the lime
Lime.
for this
Mhm.
one.
Mhm. Now, in this recipe, it does say an ounce of non-alcoholic rum. I'm here to tell you, and so is Brandy,
need
you
it.
don't need it. You really don't. A mojito's a mojito. And it really is all about the lime and the mint leaves. And so,
This is club soda.
yep. And so you're just topping it off. And then are you doing 3 ounces of pomegranate juice?
Well, I'm kind of out of pomegranate juice.
Well, let's
so
do
we're just gonna
cranberry.
do-
Let's do
Okay,
cranberry
let's
juice.
do cranberry.
So you could either do 3 ounces of pomegranate or you can do 3 ounces of cranberry juice. There's some in the fridge here.
Okay, great.
Okay.
That down.
Yep.
Where's your, yep. Fridge open. Oh,
There it
I have
is.
some cranberry back here though, actually.
Oh, okay. So, and you may be wondering, what do we use here? So this is Ocean Spray. It's the 100% juice version. That's a little more tart, shall we say. It's not sugary sweet. So I suppose if you use the real sugary sweet one, you would maybe could back off on the simple syrup or the powdered sugar, etc. So so this is 100% juice, no sugar added. So that helps.
Then a little smaller piece of lime to garnish. And I just kind of drizzled the cranberry. Some people might prefer exact measurements. I just kind of eyeball it. And then this is a mint leaf that has more of a stem to make it a little prettier, is how I did that. And then I think this is a fun holiday. You could either put real cranberries in, or you can take some pomegranates and just sprinkle them.
I think those are called Avrils, the pomegranate Avrils.
Avrils?
Yep.
Okay.
So you can get
Yeah, so
these
it's
at the
not-
store.
Not a whole
So
pomegranate.
it's the
what's
basically
inside.
it's the juicy seeds of a pomegranate, right?
You get a good, I can't get a,
Here. I don't know if you can see,
Kind of see it from the top,
Yeah, a little
yeah.
bit. Sorry about that. We're doing the best we can, but look at the glass. Cheers.
Beautiful.
Cheers. Let's see what it tastes like. Mm, that's really good.
that's good?
Mhm.
Okay, good.
Now, say if it was a little too sweet, we could just add some more lime. You could maybe add a little more lime juice or a
club
little
soda.
more club soda. You may ask, what about brands? It's all a personal preference, To me, club soda is kind of club soda. We like Seagram's, etc. But you can just get whatever you want.
I'm gonna
Okay?
try this espresso martini. I'm excited
Yeah.
for this
I'll
one.
let you.
So
back.
Brenda found this fantastic recipe. I made some decaf espresso in my
Okay, good.
ATTH mug.
A time to heal mug. Oh, here's the.
Oh yeah. Here's my cheat sheet.
Yeah. Here's how easy it is, you guys. It's so easy. It's an ounce of espresso. So if you don't have an espresso maker, or if you don't have anything like that, you can literally buy bottled espresso at the store. You can buy K-cups that are espresso. It's just that really nice, strong coffee flavor.
Or even, yeah, just make some really strong Folgers. I mean, I don't think that's as good, but it would work.
It'll work, yeah.
So this is that I'm adding is sweetened condensed milk. It's 1 ounce. You could use a shot glass to measure it, but I think that's kind of messy, so I prefer to just spoon it in. And with this too, this could be a taste thing, is it might make it a little too sweet or it might make it perfect. So you might want to adjust. And then just 1 ounce
2 ounces.
of, or excuse me, 2 ounces of skim oat milk. So I need a little bit more.
Yeah.
Stop paying
It
attention.
calls for skim milk. We have oat milk here, so that's what we're using. You can use whatever you want. And she's pouring, so the 1 ounce espresso, 1 ounce of the sweetened condensed milk.
And I
And
had
then,
ice in here too
yep,
to
and
start.
that was full of ice. That's the shaker. And then 2 ounces of skim, oat milk, whatever you like. And then again, you could do the 1 ounce of non-alcoholic vodka, but we just don't think it's necessary.
You got me. Oh, sorry. I kind of flung some
What do you
liquid here.
want?
The coupe glass, I
Oh,
think,
gonna-
is what I want.
There we go. Put it in there. Oh my goodness, that's beautiful.
So yes, you could pour this into a coupe glass or a classic martini glass. Or if you say you have arthritis and holding a stem glass isn't comfortable, you could even put it just in an on the rocks glass if you want a firmer grip.
I bought these. It says a espresso bean cocktail garnish, but I suppose you could just put regular espresso
Right?
beans if you happen to have them.
Ooh, I like that.
Is that good?
We might have done a little stronger espresso, but I like really strong.
Oh yeah, that's really good. And to be honest with you, with the espresso martini, that's why you're not missing the alcohol, because that's usually what you taste is the coffee. And it is a wonderful flavor. So I sprinkled those espresso beans in there. You could sprinkle some chocolate shavings on the top. And what a lovely Christmas morning drink, that you
Even
could have.
some candy cane.
Oh,
pieces.
yes.
That's lovely.
Okay. So you guys you're gonna laugh. I bought this from Williams Sonoma. It's called Peppermint Snow. They really got me. Literally go buy a bag of peppermints and crush them up. It's the same thing. And you can sprinkle that on there. Wouldn't that be yummy? So then it's almost like a peppermint, chocolate peppermint coffee, right? Or Starbucks. We're trying to
Exactly.
take over from Starbucks.
Speaking of coffee and hot, with the snow coming down, a hot beverage is sometimes what you're in the mood for. And you can just take a regular coffee and they make like a non-alcoholic coffee flavoring. Brenda has some coffee flavorings here. You can get that in an Irish cream and it tastes like a Bailey's. And you just pour that in your coffee. Easy peasy.
So guess what, folks? We're getting to that point. I'm going to go ahead and let you
Yeah.
show what you're doing here.
A fun thing to do too. This is just a salted caramel sauce. This is from Whole Foods. I think you can get it from Amazon too. You don't have to be this fancy. You can use a salted caramel coffee syrup or just caramel. But you kind of like take a clear glass and kind of do that. It's pretty.
Look how pretty. Fun.
And then add some hot apple cider.
Oh.
And I don't like the packets. I like the real bottle of apple cider. And you could even get fancy with your apple cider and add like some orange slices and cinnamon and
Cinnamon
nutmeg,
sticks. You can buy cinnamon sticks. That would be great. I think
things like that. And then you have a nice, pretty hot drink
yeah.
as well.
Could you even put a little salt in there, like a salted caramel and apple?
Totally could do that.
And once again, can't go wrong with a fun glass. Come on. It's so much fun. These things are important. They really are. And again, it's all about the presentation. And a lot of these things I know you guys have sitting around, if you orange juice, orange slices, some lime, some mint. It really is easy, especially the espresso martinis. That's so easy to do. And I promise you, people are not going to know the difference. Oh, thank God you remembered this. I didn't. I almost forgot. So, oh, we almost forgot this. This was the spritzer. So here's another fun glass. Can you see the sparkly? You could literally tip the glass over and these sparkles go
Oh,
flip around. So how about this? We've just got some
Just-
cranberries and
yeah.
ice. You guys, can I just tell you? Put them in here. How pretty, right? Can I just tell you hilariously? Do you know the last time I had ice cube trays in my house? I can't even tell you. I was like, I don't have any. I had to go buy some. Thank God they had them at the store. And but aren't they fun? So you can do all kinds of things. You can also put a little sprig of rosemary in here and it looks like a Christmas tree, right? So you can do that and look at this lovely festive wine glass. Fun. Okay, so that is just a few things. And so now we're going to get to why you're all here, right? So we've got some giveaways to do. So I'm going to get Jeannie back on. And this is something we're also going to give away. So Jeannie, can you put up a picture of what we're doing? So I want you all to have a wonderful experience with your mocktails, okay? And we just wanted to show you a few ways you can do it. But Jeannie, go ahead and can you put up?
Yes, I'm going to stop our recording. So before we do our giveaways, but so
Okay.
thank you all for coming or for listening as recording. Please, everyone, stay on for our giveaways here.
Perfect.